Hi everyone, I want to talk about sinusitis. Someone just walks to a doctor and says, I have trouble with my sinus. Okay, let's go. Sinusitis is simply defined as the symptomatic inflammation of the nasal cavity and paranasal sinuses. And the paranasal sinuses are sphenoid, frontal sinus, ethmoid sinuses, and maxillary sinus. The paranasal sinuses are expected to be sterile. They are normally sterile. What are the clinical features? Acute sinusitis is called acute if it's less than 4 weeks. Recurrent is called recurrent if we have 4 or more episodes in a year. That qualifies it to be called recurrent. Chronic, if sinusitis is occurring in a way that is greater than 12 weeks with or without treatment. In other words, your friend has sinusitis and has been battling with it now for 12 weeks, has taken medications or has not, but no resolution in 12 weeks. That is chronic. The individual with sinusitis will have what we call nasal speech. When he or she talks on phone and you are not even there, you will sense it that no, there's something happening to the voice of this person. This person is having blockage. So the other person will say, though, you sick? You having cold? You can easily pick that. And there is going to be facial fullness. The person will just feel that the face is, getting full somehow, feeling the pressure on the face there. Nasal congestion or obstruction, drooling, sneezing and everything like that. Fever, depends. If it is viral, it's going to be low grade. If it's bacterial, it could be high grade. Anosmia, of course, this is not the person you are going to call to come and sense there is odor here in this room or not, because they may not be able to perceive that while having it. Halitosis, don't run away from them. When they come closer to you and they open their mouth to talk to you, you get pissed off. Why? You're going to sense that horrible odor. It's not their fault. When you get treated, you get out of it. Ear fullness. They'll think that something is in their ear. They do everything to get it out. It's not getting out unless it resolves on its own if it is viral or is treated if it's bacteria. That could be ear pain. It could become fatigue, particularly when it is becoming systemic. Dental pain, purulent discharge. When that is seen, then you know you are dealing with something serious, and it's bacteria, of course, and you need to act fast. Acute cases are usually viral in origin, and the history could be that not the only person involved. In other words, it might be other people in a place of work or other people in the family or anywhere he or she is living. That will give clue that this is likely going to be viral. Viral upper respiratory tract infection could be complicated by bacterial sinusitis. So the fact that it is viral doesn't mean we are going to do nothing, because the individual could come down with bacterial sinusitis superimposed upon the viral upper respiratory tract infection. Postnasal drip is possible. What are the possible investigations here? You can do CT, you'll be able to see clearly everything that is going on. You can do your X-ray, of all those if the CD is not available or is not covered. But doctors could make clinical judgment by the history and physical examination alone. They'll just palpate the maxillary region for tenderness, check the dental area for any caries and everything associated, look for discharge, the nasal discharge, and check the visual acuity, rhinoscopy, look inwards into the nostrils, otoscopy to check the ears, and palpate all the sinuses for possible tenderness. What are the risk factors? Somebody is allergic to many things, and a particular thing, and is not having contact with that allergy, and is now coming down with rhinitis. So allergic rhinitis, asthma, cystic fibrosis, I've presented the details, everything about cystic fibrosis and asthma. Kindly check out my presentation. So I'm not going to go into details of those two here again because it's going to be repetition. Check my presentation on asthma and cystic fibrosis. Nasal polyps, levator septum, gastroesophageal reflux disease. Again, I have a presentation on gastroesophageal reflux disease. Kindly check it out. Immunodeficiency, of course, when immunity is down, then you become a ball in the hand of virus and bacteria. Eosinophilic non-allergic rhinitis. I'm going to make a separate presentation on that very soon. So those are the risk factors for sinusitis. How do we prevent the spread or coming down with it? Hand washing. If you're affected, don't spread it to somebody else. And even you to get contacted, make sure you wash your hand so that you don't pick it by droplets in any way. Quit smoking. How many times have we talked about smoking and about how many diagnoses? I can't count the numbers anymore. Quit smoking, please. It's not easy, but it's going to be helpful. Decrease allergies exposure. The first thing to do when you have allergies, I have a separate presentation on allergies. Please check that out. When you have allergies, the first thing to help yourself is identify what you are allergic to. And once you could identify the item or the items, you avoid such item or items like plague. We want to treat, but we'll start with non-pharmacological remedies. Steam inhalation. Be careful, don't dip your face in hot water and get started. Please don't. Hydrate well. Hydrate well. Drink a lot of fluid, drink a lot of water. Sleep well. Rest, but not on duty, not while you're at work. Raise the head of your bed. Okay? Warm facial packs. Warm facial packs. Some will add menthol to the steam treatment. I'm not particularly prescribing that, but if you choose to, it's your choice. Pharmacological intervention. Resolution in 2 weeks with the decongestants and the measures above. If you are able to get that, fine. In other words, if you embark on those remedies and you use the decongestants and within 2 weeks you find that's it. Analgesics and antipyretics like acetaminophen and ibuprofen to relieve the pain and the temperature. And nasal decongestants better than oral because of the side effects. So most people would prefer, or most doctors would prescribe nasal decongestants. Topical decongestants for 3 to 5 days. We don't want you to be on this decongestant for a long time because it's not good for your heart. No cough and cold preparations in children, please. Let me repeat. Cough preparations and cold preparations, please don't give to those children. Pseudoephedrine in less than 6 years will cause serious problems. In fact, some children have died from that. So no pseudoephedrine in any child less than 6 years. As a matter of fact, I will not prescribe it to any child. Amoxicillin or clavulane in both children and adults. You can use that like you are treating otitis media. And levofloxacin or moxifloxacin, I'm going to limit that to adults. Some may be comfortable to give it in children 8 years and above. I'm not. I will limit fluoroquinolones to adults only. So levofloxacin or moxifloxacin in adults. What are the possible complications? Okay, and that might be the reason why I'm going to spoil you to make sure you have treatment when you have sinusitis. Don't take it for a joke. There's possibility of orbital cellulitis, then you have trouble with your vision, pain there at the socket. When you turn your eyes left and right, you feel pain all the time. Brain abscess can go up into the brain, form abscess there, fever, headache, and all this stuff. Meningitis. The meninges are inflamed, and you know what it is? The neck stiffness, rigidity, fever, with all the possible complications. Septic cavernous thrombosis. You know what it is to be septic? You know what it is to be having thrombosis. You know what that could lead to. When it blocks the artery to a particular region, you know what the implication could be. Osteomyelitis of the sinus bones, then you need to be treated for a long period of time. Oral antral fistula, all these complications are detrimental. For this reason, please seek help on time. In conclusion, please don't ignore that sinusitis. The possible complications could be detrimental. Get the help on time. Thanks for watching my presentations. Kindly subscribe to my channel so that you can get all these publications as soon as they are published.